From the makers of vet-recommended Greenies dental treats comes an easy way to support your dog's wellness. Greenies Smart Essentials Dry Food delivers complete balanced nutrition with science-backed recipes. Greenies Supplements, developed by a team of PhD animal nutritionists, offers options to help support healthy joints, digestion, and more. Whether it's mealtime or mobility support, Greenies helps you care for your dog from the inside out. Learn more at greenies.com.
Welcome to Veterinary Vertex, the AVMA Journal's podcast, where we delve into behind-the-scenes look with manuscript authors. I'm Editor-in-Chief Lisa Fortier, joined by Associate Editor Sarah Wright. And today we're exploring how oral Trazodone results in sedation, but it doesn't quite result in a xylazine-sparing effect in horses, with our Journal Award winner, Emmett Swanton.
Emmett, thank you so much for being here today.
Yeah, thank you guys for having me. Excited to be here. Talk about all things horses.
And before we dive in, could you share a little bit about your background and what brought you to this project?
Yeah, so I am originally actually from Toronto, north of Toronto, and did my DVM in undergrad and rotating internship at the Ontario Veterinary College in Guelph, Ontario. And then decided that it was time to diversify the portfolio a little bit. And then ended up at the University of Wisconsin-Madison for my anesthesia and analgesic residency. And then sort of pretty common for specialty colleges, but for the anesthesia college, we have to publish at least one primary paper. So this was my resident project. There was a few options when I was, starting residency, a few like projects that were on the go that I could have jumped in on. But this equine one kind of caught my eye. I come with like a large animal background. Originally growing up in the country, originally wanted to be a cow vet, and then as veterinary medicine does, our paths twist, turn, and 360, 180, whatever you want to call it, and ended up in anesthesia, but was excited to work with some large animals and do this project.
Emmett, your AJVR article describes how oral low-dose Traz might increase xylazine requirements. What was the motivation for this project?
Yeah, so that's a great question. And I think globally, like if we take a step back and we look at equine general anesthesia in general, I think if you pull up, so every few years across the board, there's this big study that comes out and it's called the Confidential Inquiry into Perioperative Equine Fatalities. And it's kind of where we look across the globe, lots of countries participate, and we kind of assess like what's going on in terms of perioperative fatality when in relation to anesthesia with our equine patients. And most recently, the new one was just published this spring in 2025 in VAA. And what we found is pretty consistently that the mortality rate of horses undergoing general anesthesia is about 1.2%. So, and then if we break that down further, because obviously colics are a big part of horses going under anesthesia, but if you kind of tease out the colics and we look at just like even healthy horses undergoing elective procedures, their mortality rate is still about 0.6%. So it's really, really high when if we look at a comparison in this number to say small animals. What you'll find in the new edition in Lum and Jones is they do a really nice job of like kind of summarizing all of the mortality studies in small animal patients that we have out there. And again, there can be so much variety and of like what's included in this, what's included in that. And kind of what they sensitize it down to is that it's small animal patients, dogs and cats, healthy, undergoing elective general anesthesia. That mortality range is about 0.05% to 0.25%. So like a huge difference in that our equine patients have a lot higher risk of mortality under anesthesia. And then we know that the biggest time for our equine patients to have a mortality event or to have complications is definitely going to be recovery. Because, we have these big horses that, they have their fight or flight and they like their knee jerk reaction is to like fly up and get away from us. And then when they're under inhalant anesthesia, they have like a lot of muscle relaxation and they're usually not steady on their feet. And that predisposes them to myopathies, fractures, all of these like really horrible things that can result in mortality and, sometimes them having to be euthanized in recovery. So what we typically do is that a lot of times our patients have to be heavily sedated, equine patients have to be heavily sedated going into recovery. And the idea is that we keep them asleep under injectable, and then they're going to breathe off that inhale, and then they wake up with from an injectable recovery. They wake up nicer. So the idea with this study was that if we gave them trazodone up front and we got them maybe more sedated, um, preoperatively, maybe they needed less drugs to get to that safe plane to induce them, because obviously we need a horse to be very sedate to be able to induce them, because we use ketamine dazolam. We don't want them to be excited from the ketamine. Um, Kind of our hallmark preoperative sedative in equine patients are alpha 2s, which I could go down a rabbit hole about why we want to reduce the amount of alpha 2s we sometimes give our patients, but we won't do that. And so trying to reduce that up front, and then if the trazodone sticks around and they can recover better, the idea would be that might help them as well. So that was kind of the reasoning for doing this study, was seeing like where can we continue to improve this like population of patients that's at a relatively high risk compared to the other species that we're anesthetizing.
Is there evidence or clinical observations to suggest this interaction between traz and xylazine?
So the one that obviously the findings in our paper were that we had increased sedation scores, but when we look at the low dose trazodone group, they actually required more xylazine, and there had been nothing previously published about that out there in the literature. I think there's very limited studies about trazodone on horses at the time of this. When we were doing our research, and a lot of them just more focused on, like, there was one that, like, looked at how often they were walking in their stalls, if it was, like, good for cage rest. There was, like, a study about using it for opto exams. So this really was, like, there was nothing out there about the drug interaction. This was kind of the first of its kind and the first of the findings reported.
So, what are the clinician, anesthesiologist, surgeon takeaway from this study?
Yeah, I think that the great takeaways from this would be that we definitely can see an increase in sedation. So I think there is a place for this in our equine patients, and especially post-operatively, if you want to put a patient on cage rest and stuff like that. I think that there is a role for trazodone, and I think, one aspect that our study at this time didn't really look at is the recovery, and I feel like that's a whole untapped area that can be explored. And, um, as a resident, we move on from where we trained. So I have like moved on from the university, but I know there's like work on clinical studies there looking at like recovery scorings and stuff like that, with horses getting oral trazodone as like the next steps of like the foundation this first paper laid down for them. So hopefully that will be continued to find good results and use.
So, what are the key take home messages you hope veterinarians and clients will remember?
Yeah, I think like the key takeaways that I hope people remember is that, trazodone and perioperative like oral sedatives are not just for our small animal patients. I think, clinicians are really good in the small animal world of like, dogs and cats are coming in on their Gab and Traz before their anesthesia, before their vet visits, and that's great. And that's great for the patient anxiety, but also from an anesthetic perspective, I can find you lots of papers that show you trazodone and gabapentin are going to reduce your propofol, they're going to reduce your gas. So I think that we need to like shift the mindset and remember that we can also use those in our large animal patients, and it can be beneficial too.
It's not just the gas of the patient, it's the gas in the environment as well.
Exactly. Yep.
Yeah. All right, let's shift and talk about winning one of the AVMA Journal Awards. How did it feel, Emmett, when you found out you were nominated and then you won an award?
Yeah, I was so excited. I remember, I think like I had just started board study, so kind of a dark day. You're sitting at home for weeks at a time, holed up with textbooks and charts, and then getting this email was like so exciting. I remember like the first people I texted was like my two faculty who were on the paper with me, Carrie Schroeder and Becky Johnson. I was like, "Oh my God, look at this. This is so exciting." So yeah, we all three of us were super excited.
Well, you already answered my next question, which are the primary people that, the immediate ones you want to reach out to. And for other listeners, if you could go back and tell your resident self or your students one thing about this journey into residency, completing a project, getting it done, designing the project, what would it be?
Yeah, for sure. I think at least for me, before like I went into it, I had this like guise or this idea that like research was like, scientists sitting at their lab benches or sitting in labs in white coats, and that like it wasn't fun. And that some of those results like weren't necessarily applicable or like had like clinical relevance. So I think like what this study showed me that, research can be fun. Like I said, like myself and the two other faculty, we spent days at the barn with the teaching horses. We were having a grand old time, hanging out. So it was lots of fun. The sedation score we used, like it's a validated equine sedation score, and it involves like opening an umbrella in front of the horses. So like we're out there in the middle of Wisconsin in the winter, like opening umbrellas in front of horses. So I mean, it was fun. And then I think like the results are really cool and they're like applicable and useful. So I feel like I've talked to like equine colleagues that are like, hey, like we saw your paper and we like give our patients trazodone and it's like they're sedated, they sit in their stalls. So I think that's been like super rewarding and just like a shift in mindset that I think research can be fun and it can find results that are actually gonna hopefully improve things for our patients. So
I'm so glad you said that actually. I have a friend who's a small animal general practitioner from vet school, and I was eating dinner with her this weekend, and she was like, Sarah, I don't know how you do your job. She's like, I could never do that. I'm like, no, it's not just like benchtop research. I'm like, it's really cool advancements and like getting to see that and being at the forefront of the field and advancing it. Like, that's how we learn what we learn in vet school, even. It's like what's in the
yeah,
literature and what works. So, yeah, thank you for sharing that with our listeners.
yeah, super cool.
So, how has receiving this award influenced the research or your career since then?
Yeah, I think like I said, like I've left the university, so not necessarily like, in a huge research field right now, but I think it's definitely like opened my eyes that if there is a time in my career, because the beautiful thing about veterinary medicine is lots of different avenues for us to go down. That like I wouldn't be afraid or like be abrasive to like going into a position or another career path that involves research. Like I would love, I think like large animal patients, like they definitely don't get as much attention as for the anesthesia for research in general, but especially anesthesia, that I would not hesitate at all to like, go work somewhere and like, be an equine anesthesia researcher or even, a bovine um equine, or I guess not equine, but a bovine anesthesia researcher. That's my Wisconsin coming out. But yeah, I think it's definitely like made me less hesitant to like, if I see a job posting that requires research to like I'm not running away anymore kind of thing.
And what advice would you give to other researchers that are hoping to make that kind of impact in their own work?
Yeah, I think like it's really important to find a project that you're like passionate about and that does have clinical relevance. Like, I love large animals and I love anesthesia. So the idea that I can maybe improve equine anesthesia, even if it's just minuscule or even just building a foundation for like further clinical studies that other people can go on and like take kind of that torch to the next step, is really exciting. And when you're passionate about it, it's like not hard. Like I was like, oh, I can write and talk to anybody about horse anesthesia, like sign me up. So I think like that's definitely really important.
Emmett, in your career to date, were there any pivotal moments or challenges that really shaped your path?
Yeah, I think like if obviously, being someone in a specialty, I think there's always like that pivotal moment that we like think about like the day we actually like were locked in that I was like, this is what I want to do. And for me, like it's actually related to being a vet student. So like I said, I was a student at OVC and originally like thought that I wanted to be a cow vet. And then I like spent some time in a winter in Ontario with a large animal vet. And I was like, oh my God. I was like, one arm is warm, but that's not for me. Like I can't do that.
That's awesome.
So then yeah. So then I was like, oh, maybe I'll do critical care. Like we'll do something exciting. And there was a criticalist that had like taught us in our DVM program since kind of like day one. And I just remember like I thought she was so cool. Dr. Bersanis, Lexa Bersanis, and she was like just like made everything fun. And so I'd reached out to her and I was like, hey, like I think I want to do ICU, like any summer job opportunities research, like what would you recommend I do? And at OVC they hired two summer students to work in the anesthesia department. And she was like, I would go work in the anesthesia department, you're gonna get to see a bunch, do all these like clinical cases. Um So then she sent me to the anesthesia department, and I never looked back. I do remind her that when she's always like, "Yeah, you ditched me for critical care," and I'm like, "Nope, you're the one who sent me to anesthesia, so it's your own fault." But yeah, I think that was like a pretty pivotal moment where I was like, if I don't think she'd pushed me to anesthesia, I don't know if I would have found it. But happy I did. Love
Yeah.
love what I do.
It's such a great career in veterinary medicine. There's so many options.
Yeah.
What going back a little bit further, what first sparked your interest in veterinary medicine and ultimately led to where you are today?
Yeah, I think, so growing up, like, north of Toronto was kind of rural Ontario. I was, like, immersed and, very much like agriculture. That's actually what my undergrad is in. I showed beef cows growing up. I worked on dairy farms. So, like, I was, like, locked in, gonna, be a part of this agri-food system, which I think all those veterinarians are very smart and very thankful that they're there. So that's like kind of what had started me on this journey as I was like, oh, I see a role, I see a need for like rural veterinarians. And that's like what my plan was going to be. But the twists and turns had other things in store, but it definitely was like those early experiences of like working with cattle and stuff like that that was like influenced me to go into this career.
So, Emmett, what is one piece of information the veterinarian should know about using oral trazodone in healthy adult horses?
Yeah, I think like the one simple piece of information they should remember is that oral trazodone in horses works and that we should be using it and incorporating it um, in for our equine patients.
And for clients, what's one thing you wish more horse owners understood about this topic?
Yeah, I think that I wish more horses owners understood that there are like other options in terms of just our conventional, you know, xylazine, ketamine, midazolam, xylazine and recovery, and that there are lots of things that we can do, and lots of and other options other than Domitor gel for your anxious horses that you stay in the stall. That we have other things in our toolbox, and don't be afraid to ask your veterinarians for them or, open that conversation for sure.
All right, Emmett, before we wrap up, we're going to have a little fun. First, I need to know, do you have a pet?
So I did the very classic thing of I got a German short hair pointer during COVID that I love dearly. But I don't think she wasn't made for residency life. She was made for living out in the country at my parents' house. So I have a dog that I pay all the bills for, but she resides in rural Ontario quite contently.
If she could describe you in 3 words, what would she say?
Yeah, I think that she would honestly think I'm pretty annoying. I love to bug her. That I also I'm the snack police in the household, and that's probably the veterinarian in me that I'm like, yeah, you don't need any more. And also the bed hogger, even though I would argue she's the bed hogger, I'm sure in her mind that when I'm at home and we're sharing a bed, she really wishes I would leave.
That's awesome. Are you a coffee before rounds person or a coffee all day person, or are you a coffee person?
I am a black coffee all day, every day person.
No cutoff point?
Nope.
Any special brand you like best of all?
Um, Honestly, as long as it's hot and it's black and it's full of caffeine, I am there.
All right. Do you carry a thermos around so you can have it hot all day, or where do you get your coffee all day?
So we used to have what we called the jailhouse coffee machine at Wisconsin. That was like this free coffee machine that had horribly tasting coffee, but it was there all day and it was free. So that was a pretty common place. But yeah, otherwise, drag around a Yeti that keeps it pretty warm most of the day.
Of course. We talk a lot about wellness and work-life balance in veterinary medicine. So what's your go-to stress relief after a long day and even over the weekend?
Yeah, well, I'm a big like get up and go to the gym before work person. So I am one of those like scary people that's getting up at 4 a.m., going to the gym before I even get to the hospital. And that was like all through residency, something I've carried into now private practice life. I think it's just very important to move our bodies. But if like my guilty pleasure is being vegetating on the couch, watching reality TV, especially like Real Housewives of Salt Lake City. That's where you're gonna catch me 9 times out of 10.
That's awesome.
I love that. Emmett, do you watch baseball?
I was like a bandwagoner because I know the Blue Jays.
Yeah.
As a Canadian, I have to, support the Blue Jays. So I
That's why I
came,
was asking.
yeah, for about like the last week, I've understood what's happening with the Blue Jays, but that's about it.
Yeah, I was gonna say sorry for your loss. You watched the game on Saturday. We were rooting for the Blue Jays as well. The Dodgers had
Yeah,
their
me
time,
too.
but well, Emmett, thank you so much for joining us. We really appreciate you being here with us today.
Yeah, thank you guys for having me. This has been great.
And for our listeners, you can read Emmett's award-winning article in AJVR. I'm Sarah Wright here at Lisa Fortier. Be sure to tune in next week for another episode of Veterinary Vertex, and don't forget to leave us a rating and review on Apple Podcasts or wherever you listen.